Imagine going for a routine checkup and with just a vial of blood, learning your risk for Alzheimer's a decade before any memory changes show up.
Today's date is 2025-05-16. Let's start with a fact. More than 55 million people worldwide currently live with dementia. That number's only going up, isn't it?
That's right. And the real challenge isn't just the rising numbers. It's that diagnosis happens late for most people. But blood tests are starting to change that. Researchers can now detect markers like tau 217 and NFL in blood, which can signal dementia risk as much as 10 years before symptoms appear.
10 years in advance? That seems like a big leap. How reliable are these new blood tests?
Tests for tau 217, for example, are showing up to 90% accuracy in distinguishing Alzheimer's from other causes. That's comparable to PET scans and much less invasive than spinal taps.
Just to clarify, PET scans and spinal taps are expensive, require specialists, and aren't widely available. Blood tests, on the other hand, could be done in a standard clinic. Is that a fair assessment?
That's exactly the point. Take the new MTBR tau 243 test. It not only identifies Alzheimer's, but also tracks how far it's progressed. This means doctors could personalize treatment, starting earlier when interventions are most helpful.
So we could spot cases before anyone even notices their memory slipping?
Yes, and there's another angle. Low levels of acetyl L-carnitine in the blood have also been linked with mild cognitive impairment and Alzheimer's. That adds another possible marker for catching the disease early.
So we're looking at a set of blood markers, each offering a piece of the puzzle. But are any of these tests actually ready for doctors to use now? Or is it still mostly research?
Some are getting close. For instance, the UK's Blood Biomarker Challenge is running a national clinical trial right now. The aim is to bring these blood tests into routine healthcare within 5 years.
5 years isn't far off. But what are the main obstacles standing in the way?
Validation and regulatory approval are the first steps. Then we need to integrate these tests into everyday healthcare, and crucially, make sure they're available to everyone, not just those in well-funded clinics or cities.
Right, because even if the tests are cheaper and simpler, if they don't reach low-resource communities, the benefits are limited.
Exactly. The affordability and ease mean these tests could scale up widely. But unless health authorities and governments commit to distributing them, we could actually increase the gap in dementia care.
Let's dig into the impact a bit. Why does early detection actually matter for patients and families?
Catching Alzheimer's early means patients and families can plan, manage symptoms sooner, and access treatments that are most effective in the earliest stages. It's about giving people time before the disease causes changes that can't be reversed.
And when you look at it from a broader angle, this could affect how healthcare providers, insurers, and even policymakers approach dementia care.
Yes, it allows treatments to be tailored, may reduce long-term costs for insurers, and could shift government resources toward prevention and early intervention.
But we're still at the threshold. What needs to happen for these tests to move from research to routine care?
We need ongoing validation, regulatory approval, and the right infrastructure to deliver these tests widely. Plus, public education. People have to know these options are available.
Big picture. Dementia touches every community. Do you think these new blood tests could help reduce the stigma surrounding the disease?
They could. If we can diagnose early and show that real interventions exist, dementia can shift from being seen as an inevitable decline to something we can treat and manage.
So, at the end of the day, we're left with two big questions. How soon will everyone have access to these tests? And will early detection truly make a difference for patients and families?
Those are the questions that will shape dementia care for the next decade.
That's where we'll pause for today. Thanks for joining us. We've looked at how a simple blood test could reshape the future of diagnosing and caring for dementia.
Stay with us as science moves from promise to practice. Thank you for listening.